Holy mother.
Turn it down.
No. I didn't say that. I call my mother holy. Saying hi to her. You can hang out there. It's cool.
Okay. See, people say you can hang out there, and then they're like.
Boom. Hey everybody, it's Dr. Warren with Dr. Brady here. What's happening? We've got some gear. If you check out our videos from now on, you're going to see some stuff pop up. This is the first to come in. Like the color, like the comfort. I got some sweatshirts that came in as well. Extra large, nice and comfortable. So we've got some gear now. If you guys are fans or have been fans and you want to support some stuff and support us, all of the proceeds go to Hunt's Honey, and we make donations based off of that. So we don't make any money on this stuff, and if you're looking for something new, check it out. Hunt's Honey is a great nonprofit entity in Baltimore that we support by using their products, and I've got music playing on my phone. That's it. We should. We're Team Hunt's Honey over here, actually. Yeah, like it. Brady and I are going to be training for our first.
I'd say triathlon. Yeah, well, you did it first, and then I followed. I thought it was pretty cool. Trying to build some team chemistry right now.
Yeah, let's keep it going. So we're doing a triathlon. Actually, we don't have permission from either of our wives yet, but apparently we're trying to go.
Yeah, as long as we tell them before this video comes out, I think we're good.
Trained. You're not getting your permission. Gear, supporting Hunt's Honey, and a great organization in Baltimore that helps out some amazing women and serves them, and they serve right back. And then we are going to learn how to swim, and then we're going to go out and swim in the ocean for fun. And I don't know why we sidetracked into that conversation. Oh, Team Hunt's Honey. And then today's video. So if you're been a part of the channel, we try to put out some great videos relative to just treatment as well as education around evidence-based, musculoskeletal, manual therapy, physical therapy for a lot of different conditions. And something that I've been dealing with for just recently is something called heel pad syndrome. This is a really syndrome, heel pad syndrome. Basically, at the end of my day, some days, my left heel hurts. Can you relate? Probably some people out there can relate. But sometimes that tissue when it gets irritated or inflamed, it takes a long time for it to heal because there's not good blood flow to it. So I'm going to show you how I get, my heel worked on with Shockwave therapy, and then I just had an awesome week. I'm really grateful to be treating patients in here, and it was a fun week for me, and I'm physically tired in my back. Feels like I could use some body work, so Brady's going to help me out if you don't mind.
Absolutely, not at all.
Thank you.
Dr. Warren helped me out last night, so it's only right for me to return the favor here.
We're Team Hon. Honey.
That's how you say it, right, Hon?
Oh yeah.
Do you want me to take this?
Oh no, I gotta keep it on.
Okay, I gotcha.
We're representing the shirt. Team Hon.
Any particular area, Dr. Warren, that's really been bothersome for you here?
No, I've been feeling really good. I got adjusted earlier in the week.
Okay.
Alec worked on my neck quite a bit, and then I've been feeling pretty good. I saw a couple people this morning, and just feeling a little locked up in my mid back.
Okay.
And I'm gonna work out after this, and so I love to get adjusted before lifting weights or working out. It feels like it frees me up. I feel like I've got good control when I'm out there, and then there's just definitely an endorphin rush that you get when you get a good adjustment. So it's a nice combination, and we do that quite a bit in the office. Brady, I'm sorry to talk to you.
You're totally fine. And then all the way out there. All the way out. Yeah, good. Yeah, and then deep breath in here.
You need to have a mustache to be on Team Honey.
Yeah, and that's why I'm starting to grow it out now. So plenty of time until April. Deep breath in here. And all the way out. Right through there, yep. Nice.
Yeah,
And then
we're gonna.
Also,
What's
April. I'm thinking about this right now. I'm thinking out loud.
Go ahead, Brady. Think out loud, buddy.
April, is that a good time to be in the ocean? Like the water's not cold or anything.
You talking Puerto Rico?
Yeah.
Where do you live in Baltimore? It's always warm wherever
You're
we
gonna wear a
go.
wetsuit?
No,
No?
it's not that cold. It's Atlantic. I mean,
Yeah.
no.
Oh yeah.
Caribbean water, dude.
Yeah. I'm sure, yeah. It warms up pretty fast.
No, it'll be nice.
Right through there, yeah.
Nice.
Oh baby.
Oh man.
Brady, would you mind adjusting my mortise joint or my ankle joints?
Not at all.
Thanks.
Not at all. I'm gonna go into your back here.
Just doing that real quick.
Real
Just
quick.
give a little pause there for you.
I love it.
The sweatshirts are sweet. They're sweet. We'll do another video with the sweatshirts, obviously, so you can see those. Of course, you want to see before you buy.
Can you add like any effects at all? Like when he puts it up, like.
For sure.
Okay.
I hope they do that all the time on our video. Harley, help me out. I need all the help I can get.
We're gonna throw up all the fun products right here, right now.
So, Brady has adjusted. Creative talk. Go ahead. You're good.
One more through.
So you feel that one's got a little something in there?
It's got a little something here.
Yeah, like a little laxity up there. Yes. I sprained it a couple times. Just a couple.
Have you had any previous injury on that ankle?
Like a million, yeah.
Just a million lacrosse.
More so just running through the woods. Yeah, just rolling it. Probably has been my worst injuries on the lacrosse. I didn't sprain it too many times. Well, I'll save that story for another day.
I saw the wheels turning in there.
Yeah, say that story.
Yeah.
No, that's okay. So, grateful for your guys' support. Thankful for Brady, Team Hans 20. And we're going to be, if you'd like to join Teams Hans 20, and you want to come down to Puerto Rico, April 5th and 6th, it's an Xterra race. We're going to start a team on there. Looking for all the support we can get. It'll be a fun time.
Maybe even Dr. Alec, Dr. Nick, maybe Dr. Jeff.
Carly.
Who knows?
If he came down, that would be so much
That
fun.
would be a lot of fun.
Oh gosh. Think about it. Yeah. Cool.
All right. Thanks, guys. Thanks for watching,
Oh,
and we'll keep you updated.
We're gonna do some Shockwave now, so
Oh,
you can
yes.
follow me.
Yeah.
Celebrated too early.
Yeah, I did. I'm sorry.
You jumped the gun.
I jumped the gun. I won't jump the gun in April.
I gotta stop him. He's got patience. I'm taking his time.
No, you're good. Hey, nice working with you again. Watch out for future videos, all right? Coming in there, who's gonna win the race?
Who's gonna win the race? We're racing each other on the same team?
I don't think so.
Hey, welcome back. I'm with Jayla. We're gonna show you Shockwave therapy, right, Jayla?
Yes.
This is what type of Shockwave? What type of system do we have here?
We have the Focus Shockwave.
All right. So focused is different than radial.
Yes, it is.
There's different types of input you can use via Shockwave. There's a lot of different companies out there. This is a really awesome brand through Chattanooga. They did a great job of bringing this technology into our office, and they're the force behind the laser therapy as well as the radial Shockwave. I was exposed to a form of Shockwave at Walter Reed about 8 years ago, and that technology really didn't kind of surface with this type of acoustic and electrical components that we have now till recently. So this is very, very new. There's no offices in the area with Focused. Focus has been really helpful for some of the deeper structures, and radial has been very helpful for more superficial things that we deal with, as well as trigger points. So for something that's deep, like a heel pad, I like both modalities, but I'm going to demonstrate Focus today, as well as for some calf tension and Achilles tension that I have on this left side. What do I have again?
You have heel fat pad syndrome.
Yeah.
There you go.
Fat pad
You put your
syndrome.
leg down.
Yep. Common or not common?
It is pretty common. 1 in 10 people get it.
1 in 10 people?
Yes.
All right, so 10% of the population right now.
Yes.
And tell me a little bit more about it.
So, Heel fat pad syndrome is like the second most common foot sort of like injury or version of plantar fasciitis. Plantar fasciitis being the first one, and then this is the second one. And it's so common because our heels take a lot. It can absorb almost 1 to 3% of someone's body weight. So your heels are shock absorbents and they take on a lot. So when they're overused and taken on too much, that heel pad fat starts to decrease.
We can all take a page out of Jayla's book, staying on top and studious when it comes to medical conditions that come into the office. Just want to give her a shout out for the effort and the energy she puts towards patient care here.
Yes, researching always.
Always researching,
Yes.
always learning up on things.
Thanks to Dr. Warren, of course.
Listen, it's a team. And a really common thing, and it's a stubborn thing that we see. And the reason people get it is very, it can be diverse. We can get started if you're cool with that.
Okay.
Is that cool?
Yeah.
All right. Because I know I just saw Miss P just walk by. And I know
Gotcha.
she's waiting on focus for her hip, so I do.
Oh, yeah.
I don't want to hold her up. And I think Nick gave me the look like, hey,
You gotta get started. All right.
patient first. So
Okay.
we will do this real quick. I'll say this: the reasons people can get it, like you can have someone that has like a surgical intervention on the opposite side, and then they compensate, and then they kind of build that gait or that pattern over time, and then they start to stress one foot more than the other. That could be a way they do it, and it can be just habit as well. There's definitely some functional components that put people to stress one side more than the other.
I don't want to scare you. That's why I don't want to.
What, do you have this thing ramped up or something?
No. Have you had this before?
Jayla's like, I got my review next week. Let's talk about it right now.
Are you ready?
Yeah. It's my second time getting it.
Okay.
And every time, wow.
See, if he was still giving his spiel, he would have had to stop.
I would have had a wow in the middle of that sentence. That's so crazy. It kind of blows my mind where it hits. It kind of reproduces the sensation when it's really irritated almost to a certain way. Or like at least it pinpoints where that irritation is. I shouldn't say it reproduces it, but pinpoints where it is. It feels good.
Is that
It's intense right there. Holy smokes.
that too much?
No, we're good.
Okay. I'm gonna hang out in this
Oh,
area.
you're gonna hang out right there?
Yeah.
Alright, Jayla, you got it. It's yours. You got the raise, okay? So really commonly we see it, oftentimes doing light therapy and shockwave on it. So I think that if, and we're joking a little bit, right? But if you're someone that's dealing with plantar fascia, heel pad syndrome, heel fat pad syndrome, or Achilles tendinopathy, kind of all these conditions kind of lie in that same field of, just say it for what it is, in lesser words, stiffness of the tissue, overuse, overstress of the tissue. And oftentimes when we take a technology like this, it gets in there and works it, breaks up scar tissue, stimulates cellular activity, stimulates stem cell activity, and then also on top of that we utilize light therapy to use to help with that proliferation of blood flow and the good things that happen when we're healing from something. Increase mitochondrial activity, all those things. We're trying to like work that tissue, we're trying to wake that tissue up, and then we're trying to remodel that tissue through proper movement and stretching. You going up to the calf?
Yeah.
Okay. No warning. I got it. Just going straight for it.
See, I didn't know if you needed that.
Jayla, I need that.
I thought you were a pro.
I have no pro.
All right. That feels okay there?
Yeah, I'm at a 1 out of 10 intensity.
Okay. You can go up a little bit. I'm gonna hit that Achilles now. That might be. Is that okay there?
You are good there. Yeah, 2 out of 10.
Okay.
Jayla, what do we look for when we're hitting this?
We are looking for a 6 out of 10, no more than that.
No more. Why are we looking for that?
Because we don't want people to jump off the table, 1. And then 2, you still get therapeutic. It's still therapeutic if you go up to that pain threshold. We don't want it to be anything someone can't handle. All right, we have a little bit left. That was our safety break.
So dialed in for their comfort, but we also are getting some work done, huh?
Yes, absolutely.
So if I were to say to you, hey Jayla, I can't handle that, what would you do?
I would turn it down, or I would change the head to the focus Shockwave.
Alright, so holy mother.
I'll turn it down.
No, I didn't say that. I call my mother holy. Saying hi to her.
What's that for you?
I don't. What's what for me?
What out of 10?
That's okay. Will you hit a spot on that a little higher and then go medial right there? Ooh. You can hang out there. It's cool. Oh.
See, people say you can hang out there and then they're like kicking and stuff. That makes me nervous.
Well, you just have to get there. Then you're there, and then you just hang out, and then you breathe through it, and it's all right.
You want a little more?
I'm just a verbal guy. Sometimes I like to talk through things. Okay, Jayla.
Okay. You want a little more, Dr. Ward?
Yeah, I'm here for it. This is my first time I've gotten this on my foot and calf. I really want to know what it feels like. I want to experience it on this area. I've had it on my knee, I've done it on my hip, and I've had some people that are on it.
Oh, and just so you don't get confused, because they'll never.
I don't know what I was going to say.
Where do you feel this at? Do you feel it here, or is it moving?
What moving?
Do you feel it like in a different area, like in your toes or anything?
Oh, my soul. So I like using this with light therapy, soft tissue work, adjusting the ankle. Brady adjusts my ankle, and then I will when I hit the pavement and start running a little bit more, I'll come in. It's going to be a little sore, but this is a really nice way of getting on top of it. I probably haven't had a consistent amount of therapy on it, but if I really am going to be training with this guy here, Team 2020, even though he's trying to beat me in the race, I don't know what that was about. Trying to compete. Who has the better number? I don't even know. Where our team chemistry is right now is not great. We're going to work on it. Okay? But, yeah. So I'm going to get this once a week with Jayla, get adjusted by Brady along the way, and then that's usually how I'm going to manage this from a treatment standpoint. Once a week for 4 to 6 weeks, light therapy, PT along with it, soft tissue work and adjustments, quite a few different things, but it makes it speed up. And it's a really chronic, hard condition to treat, just like plantar fasciitis. So it just needs a little bit more work. It needs repetition. Wow.
Feel that?
I really do. My heel feels really good though right now. Like that first spot you hit. Right on it. Ooh, right there. Do you feel that through the head, Jayla?
I do, kind of sort of the feeling.
It's good. So, that is Shockwave, that's the adjustment, that's the Team 120, that's Jayla, who's just crushing the game, studying about different conditions, just teaching me now at this point. Since the beginning, really. Jayla, thank you.
You're welcome, you're welcome.
And then for our next video that we're going to be doing, we're going to be representing the sweatshirt on our YouTube channel. Not just t-shirts, but sweatshirts too. And remember, all the proceeds go to Hunt's Honey. Shout out to them.